नमस्ते, मैं राहुल गुप्ता फ्रॉम वी केयर हेल्थ इंडिया एंड आज हमारे साथ डॉक्टर अंकुर गुप्ता जी के. He is a neonatologist and head pediatrician at Cloud9 Hospital, Delhi. Today we are going to discuss the topic of Hmpv virus. So we are getting a lot of inquiries regarding this. A lot of people are calling कि भाई क्या हो गया, मतलब कोविड जैसा समय आ गया क्या, लॉकडाउन हो जाएगा क्या, तो इस तरह के रूमर्स चल रहे हैं जगह जगह पे. सो जस्ट टू क्लियर ऑल दोज थिंग्स we requested Dr. Ankur to give his time. Today we are going to break this down.
All right.
And clear all the fuss around it. Welcome to the conversation, sir.
Thank you, Rahul. Thank you very much.
Thank you for taking out time after your busy schedule for this.
That's absolutely fine.
So first of all, what is this? What is HMPV? है क्या?
It's just a simple as it's known as Human Metapneumovirus, HMPV. So it is very common virus which is very common in tropical countries like India, or let's say in the other tropical countries as well. It can happen to anyone. It's just like a viral infection as a fever, cough, cold. How it happens, how does it spread from one person to other?
तो सर अगर ये इतना कॉमन है, इतना है, तो इतना हल्ला क्यों, मतलब why is so much fuss around it? Why is so much like panic सा situation, मतलब क्यों हो रहा है, क्या हो क्या रहा है?
I understand. So I mean most of the things like depends how the patient is or how the person who is being conceiving this virus, what all symptoms they are suffering with. Especially this virus targets the children less than 5 years of age, or let's say more than 65 years of age ओल्ड पेशेंट्स. अब सिंपल सी बात है, जब लेस देन 5 ईयर का बच्चा है तो इम्यूनिटी कमजोर होगी उसकी. मोर देन 65 ईयर के पेशेंट्स हैं तो उनकी भी इम्यूनिटी कमजोर होगी. सो एज सिंपल एज दैट, whoever is immunocompromised, they will get it. Otherwise, a person who is already having some respiratory illness, who is suffering from respiratory illness, like in children who are having some congenital heart disease, like the children who used to get a quite frequent viral infection because of poor immunity, like in adults, that is more than 65 years of age, they are having some COPD sort of features in chest, so they are already immunocompromised, so they are more prone for it.
तो कुल मिला के सर जो आदमी जिसको कोमॉर्बिडिटीज हैं,
yes you're right,
कोई सेकेंडरी और भी कोई हेल्थ कंसर्न्स हैं, तो they are at a higher risk because their immunities are comparatively compromised. That is the main thing.
Yes, right.
और छोटे बच्चों के अंदर जैसा आपने बताया कि वो ज्यादा उनका इम्यूनिटी डेवलप हो रहा होता है छोटे
yes,
बच्चों का, तो उनको ज्यादा जल्दी पकड़ता है.
right.
तो मैं सपोज जैसे मेरे को भी हल्का हल्का जुकाम का असर है, तो बड़ी बात नहीं है मेरे को भी HMPV इस समय भी हो रखा हो.
All right, possibility. That is what the main rumor about, कि who has got HMPV. So unless or until we test about it, unless or until we do a PCR testing of by swab, by the nasal swab or throat swab, we never know which is HMPV. And it is very communicable, just like a normal viral infection, like droplet infection from me to you when we are sitting nearby, or let's say when we are eating something like sharing a thali or sharing a plate. This can happen from there as well. So that is why it is common, and that is why it's very fast spreading.
Basically सर जैसे कोविड का वायरस फैलता है, सिमिलर पैटर्न में ये भी स्प्रेड कर रहा है.
You're right.
Yes, similar to the COVID, the pattern is same.
Quite similar as COVID. And as we remember, around 4 or 5 years back when the COVID came, again COVID was also targeting the either the very very young children, or the most of the time it was adult patients only who are already were suffering from some other illness, or they are elderly. That was the population which was mainly affected by COVID.